Also new tonight, skyrocketing costs have lawmakers looking for ways to make health care more affordable. Once again, some are pushing for a public option which allows some to join the state-run health insurance plan. Our chief Capitol reporter Susan Raff explains.
I just could not afford the plans because anything I could afford, basically the coverage was so shoddy.
When Stephanie Thomas started her own business, she wanted to give her employees health care. She couldn't.
It really did jeopardize who I could hire because the very first question that employees ask of future employers is, what's my benefit package?
Those who support a public option say Connecticut has great health care, but it can be unaffordable. Lawmakers have state health insurance.
I got a call from my doctor with news that nobody wants to hear. Some test results had come back, and I had cancer. Fortunately, I was able to go and get the care that I needed. It was the toughest thing I've ever had to go through, but you know what? I had the best health care anybody could ask for.
A public option would allow small businesses, nonprofits, and labor unions to join a state-run health insurance plan. The goal is to help small businesses retain employees and keep annual costs predictable. A similar plan was proposed last year, but Governor Lamont was not in favor of the state getting into the insurance business, and some insurance companies threatened to leave the state.
This is going to be another layer of government over the top of the current system, and that's one more layer that's going to cost taxpayers money.
Another plan, also getting bipartisan support, is aimed at reducing insurance premiums through a reinsurance program and allowing people to buy prescription drugs from Canada.
We're looking at trying to keep costs down, not only in healthcare, but also the number one driver, which is prescription drugs, as well as looking at premium relief for Connecticut families.
State Comptroller Kevin Lembo wants action.
If you've got ideas about ways to make it better in your view, please bring those to the table. And if you've got nothing to say, shut up and get out of the way.
A number of health care bills are being introduced this legislative session. Some have bipartisan support, others do not. And while we all know that the cost of health insurance and premiums is way too expensive, finding affordable solutions are a challenge. In Hartford, Susan Raff, Channel 3 Eyewitness News.